Hello, my name is Devin Perry, and the topic of my presentation is the plague. Real quick, just to get started, I want to discuss the outline for my topic presentation today. First, going to be talking about the transmission of the plague, clinical signs associated with the disease, diagnosis, geographic distribution, treatment, prevention options, the use of as a bioterrorism agent, as well as the historical significance. All right, regarding transmission, the plague is caused by an organism known as Yersinia pestis. It is a gram-negative coccobacillus. This particular organism is transmitted by the bite of an infected flea, more specifically rodent fleas. It is carried on animals such as prairie dogs, ground squirrels, and other types of rodents. We can also see transmission occur from animals such as cats and dogs that get infected, more specifically cats, from infectious tissue, exudates, things like that. We do see some cases of human-to-human transmission that doesn't happen very often. All right, so right here we have a little bit more information about how the plague is transmitted. You see on our left, we have the sylvatic or the cycle that occurs in nature. Normally, it just remains restricted to these rodent reservoirs. However, when we have things such as epizootics, which is an epidemic within an animal population, and their normal host dies, the fleas will then look for other organisms to feed off of, and that's oftentimes when we start to see disease outbreaks within our pets as well as within humans. All right, so clinical signs of the plague. So there are three different forms that we can see with the plague: bubonic, septicemic, and pneumonic. With bubonic, that actually refers to swellings that will occur. Basically, your lymph nodes are getting enlarged, and the picture on the bottom left shows an example of that. That is an inguinal lymph node that is enlarged. These buboes are often painful to the touch. The septicemic form means that we have a significant amount of the organism or a bacterial organism circulating through the blood. Okay, so we can end up with things such as gangrene or what looks like frostbite on this gentleman's foot. Pneumonic form is the least common form. However, it is the most deadly form. That was the one I was referring to previously as far as human-to-human transmission. This is the only way that it can occur, and it happens through infectious droplets that are exhaled or sneezed out by the infected individual. I have here that we present with flu-like symptoms, and this is just generally speaking for all different types of forms of the plague. So fever, malaise, lethargy, things such as this. All right, so as far as diagnosis of this organism, we're looking at culture, whether it be blood culture or from the sputum of an individual. We're also able to look at it underneath a gram stain. Lymph node aspirates can also be taken as a diagnostic test. All right, regarding distribution of the plague, it is concentrated more so in the southwest as well as somewhat along the west coast. As you can see, there are a few cases that have happened in Nevada. It should be noted that this information is from the CDC and is up through 2012. We do have cases, a few cases every year, seems like, and it is something that is considered reportable by the CDC. We don't want this happening in our country as best we can. Here we have the global distribution of this particular organism. So if looking at the legend, it can be a little bit deceiving at first sight. So the one dot that's in North America or the United States doesn't mean that we just have one. It just sort of corresponds to the number of cases that we see. So for the most part, after about the 1990s, the majority of the cases globally of the plague have occurred in sub-Saharan Africa, as you can see in the description. All right, so as far as treatment goes for this particular organism, it is important to know that an early initiation of treatment is crucial for overall survival of the individual. When it comes to the bubonic form, mortality rate, if left untreated, is between 30 and 60%. About the same for the septicemic form. For the pneumonic form, mortality rate can reach upwards of 100% if left untreated. So luckily, there are several different types of antibiotics that are approved for treatment of plague infection, all types. I have a few listed here: streptomycin and doxycycline. There are also some fluorinated quinolones that are approved for treatment of this particular disease. All right, so as far as prevention goes, primarily what we're looking at is rodent control, so control of the organism that carries these fleas. So without rodents around, you won't really have a rodent flea problem. Also, making sure that an individual uses insect repellent on themselves so that it will deter insects such as fleas from wanting to bite them. Also, if you live in a plague endemic area, not allowing or making sure that your pets, if you have any, have flea and tick control to help them prevent them from getting flea infections. And once again, if you live in a flea endemic area, not letting your cats and dogs lay in the bed with you, because it would create a good situation for one to get bitten. The plague is an agent that is on the list of organisms that we're worried about for bioterrorism. Reason being is because if it was made into an aerosolized form, then we could have a situation where the pneumonic form of the plague is what is being caused, and if you were able to create an organism that was easily transmissible through the inhalation route, then considering how deadly the form is and the fact that we don't have a lot of the plague right now, and physicians might mistakenly diagnose it as something else at first, could allow for potentially high mortality and morbidity. And then finally, the plague is something that has had pretty big significance over the last several hundred years. I actually didn't realize this, but there are three major plague pandemics that have happened. The first one was in the Justinian period, which is started around the 541 AD and lasted for about 200 years. The second one, which is the one that I'm most familiar with, is the Great Plague or the Black Death, which is when it was given that name. To your right, we have a picture of a plague doctor around these times, and so this funny outfit that this individual is wearing, the mask is beak shaped, and it's said to have been made of a heavy leather, and the nose part had spices and other herbs that were intended to help prevent them from smelling the infection that a plague infected individual would have. We also have long clothing that would help to prevent flea bites, and a stick or a pointer, which would allow them to examine the patient at a distance. The most recent plague epidemic or pandemic, that happened was in China, and that was about the 1860s. Currently, we do have plague epidemics that are happening, but once again, these are primarily in the African continent. Here are my references.